To begin, the non-sterile user will retrieve the Lantern ASC reusable navigation unit in the SmartPack kit. Next, the non-sterile user opens the SmartPack kit and removes the non-sterile SmartPack battery. The non-sterile user opens the sterile packaging to the sterile user. Who will locate the sterile cover and transfer tool, and the CR2 battery. The non-sterile user will then insert the SmartPack battery into the reusable navigation unit and power the unit on by pressing the button located on the back of the navigation unit. A blue indicator light will appear, confirming the unit is powered on. Next, the sterile user will locate the reference sensor and mounting bracket within the instrument set. Before transfer, the non-sterile user should verify the remaining case count displayed on the screen. Once the case count is verified, select Get Started and proceed with the aseptic transfer process as demonstrated on the screen. Next, the sterile user then picks up the sterile cover with the white transfer tool and holds it up for the non-sterile user to drop the navigation unit into. The non-sterile user places the navigation unit through the white transfer tool and removes the white transfer case, ensuring to only touch the white transfer tool to maintain sterility. The sterile user secures the container by closing from the back of the case and securing all 4 locks. Confirm all 4 locks are engaged as indicated on the screen. The first step is installing the battery into the reference sensor. The sensor uses a CR2 battery. Once inserted, an orange light will appear blinking, indicating it's searching for a connection. Verify the serial number on the back of the sensor matches the one displayed on the screen and allow the system to pair. Now set up your procedure options. Select whether you're setting up for a total knee or partial knee, then indicate the operative laterality. Next, select which surgical steps you would like to do and whether you'd like to execute femur cut or tibia cut first, then hit the right arrow on the bottom of the screen. Next, assemble the navigation unit for calibration by placing the navigation unit and reference sensor on the mounting bracket as shown on the screen. Then hit the right arrow on the bottom of the screen. The calibration sequence includes 4 steps. Start with the unit horizontally. Next, stand the unit vertically. Then place the unit on its left side. Finally, place the unit at a 45-degree angle on the table. At this point, initial calibration is complete. Next is balance calibration for those who utilize this feature. Begin by locating the following instruments: the base of the balancer, the femoral paddle, and the calibration bracket. Start by pinching the tabs on the tibial paddle and insert the femoral paddle into position. Next, disassemble the navigation unit and reference sensor from the mounting bracket and attach them to the balance tensioner. Once attached, press the right arrow on the bottom of the screen. Then place the balance tensioner horizontally onto the calibration bracket. Next, rotate towards the table at an angled position as demonstrated. This completes the balance calibration process. Set the assembly aside for later use. Finally, locate the drill guide, the torque wrench, and the appropriate drill plate from the balance tray and set aside for later use. Now let's prepare for surgery, starting with the femoral instrumentation. Remove the following instruments from the tray: 3 headless pins, 2 headed pins, the powered pin driver, femoral drill guide, femoral jig, white screwdriver, femoral cutting block, and depth gauge. Next, assemble the femoral cutting block to the femoral jig. Place the jig into the locked position by sliding the gold latch over the post. Attach the femoral cutting block by aligning the arrows on both components. Then, ensure the jig is in a neutral position by adjusting the varus valgus and flexion extension screws using the white screwdriver. This completes the setup for the femoral instrumentation. For users executing the tibia cut, press the arrow on the bottom of the screen to proceed to tibia setup. Next, assemble the tibial instruments. Remove the tibia jig, the ankle tube, malleolar probe, midline probe, shin spacer, calf strap, tibial cutting block, and the resection stylus. To assemble the tibial jig, first lock the varus, valgus, and slope levers, and confirm the correct laterality visible proximally. Next, attach the ankle tube by pressing the spring lever and sliding the tube into place. Then attach the malleolar probe to the distal end of the ankle tube by pressing the release button and sliding the probe fully into position. Place the midline probe onto the proximal end of the jig and snap the shin spacer into place. Finally, set aside the calf strap for intraoperative fixation of the tibial jig. Once these steps are complete, verify surgical selections and the lantern system is fully assembled and ready for use.